When someone's heart stops, survival depends on seconds and on a system designed to respond fast. In Thurston County, that system is called Medic One. CPR starts immediately.
Start CPR.
Firefighters and EMTs in the Lacey Fire District are training for one of the most critical emergencies they will ever face: cardiac arrest. What begins here as a training scenario prepares them for the real calls that will come without warning.
So we're almost a minute there on our 2 minutes.
You want to put your suction on that. We got it.
Bag valve mask ventilation. EMTs preparing advanced airway gear.
Okay. 10, 9, 8, 7, 6. Okay. All right. 2 minutes up.
Stand clear.
Okay.
Analyzing now. Stand clear.
All right. Clear the patient. Work your back to the chest. Sorry.
Cardiac arrest. Team response. Cardiac arrest is one of the most time-critical emergencies responders face. When the heart stops beating effectively, blood flow to the brain and vital organs quickly begins to fail. Immediate CPR keeps oxygen moving through the body. An automated external defibrillator, an AED, can restore a normal heart rhythm in some patients. When paramedics arrive, they add advanced treatments including medications and cardiac monitoring.
Nope. Just increasing my dose.
Okay. It should automatically increase its joules.
So, history, as far as witnessed, okay, unwitnessed, and
10
then
seconds.
age. 10 seconds.
What's your next medication that you're...
Each step is practiced again and again in training, so that when the moment comes, every responder knows their role. Across Thurston County, emergency medical care is built on a system known as Medic One. When a 911 call comes in, firefighters trained as emergency medical technicians, EMTs, are often the first to arrive. They begin care immediately using basic life support. It's a model that combines speed, teamwork, and advanced medical care to give patients the best possible chance of survival. If the situation requires more advanced treatment, paramedics respond with advanced life support, known as ALS. Working together, EMTs and paramedics form a coordinated medical team long before the patient reaches a hospital.
We're going to talk about our system, your certification requirements, medications that are carried by EMTs, understanding and navigating that protocol book, and then afternoon supraglottic credential class with instructors coming in. So in the beginning, Medic One was established in 1974 here in Thurston County. And it was the first public county-wide tiered response EMS system in the United States. It's a strategy for handling incidents or needs by matching the level of intervention and resources to the severity of the situation. Patient calls 911 and then tells them what their complaint is. There's a certain set of criteria that the dispatch center will ask them. And then they determine whether or not a BLS unit, basic life support unit, can manage that, or do they need to also send a paramedic unit, depending on what the complaint is of the patient. Paramedic transport units are dual role, which means we're EMS and fire. So we're trained for both, just like you guys are as EMTs. And then we're staffed with 2 paramedics. We've got 2 private ambulance companies, Olympic and AMR, that provide basic life support, and then they also do EMS interfacility transports. So the private ambulance companies are all EMTs and BLS. A lot of us now have aid units that can also transport BLS patients. But I know, like with Lacey, our goal is our folks only transport if there's not a private ambulance company that's available. Or if it's what's in the best interest of the patient, if a private ambulance is way far away and it's going to be way too long to sit on scene. The system is funded by taxpayers through a county-wide EMS levy. The nice thing about our EMS levy is not only does it fund the paramedic units so that if the paramedics feel it's a life-threatening situation, they need advanced care, and the patient gets transported by a paramedic unit, there's no fee for the transport. Medic One also helps fund all of the departments for their EMS supplies that are needed to be able to respond, including BLS. Thanks to our tax-paying citizens that have approved it. And so no additional fees for a fire department response. So it doesn't matter how many times they call us, so you don't get charged for us to come and assess them by any of the departments.
Emergency responders also train to treat the everyday injuries and medical problems they encounter on calls. A suspected fracture may need to be stabilized with a splint. Trauma tints may require spinal protection with a cervical collar. Each skill requires careful technique,
You got that headache. Scale 1 out of 10, 10 being the worst pain you ever felt.
clear communication, and teamwork. These practical exercises build the muscle memory responders rely on during real emergencies. Part of an EMT's job is recognizing when a patient needs more advanced care. During training, participants learn how to quickly assess a patient's condition, checking vital signs, evaluating symptoms, and determining the severity of the emergency. If a situation calls for advanced medical treatment, EMTs can upgrade the call to request paramedics.
Push against them. You squeeze both fingers as tight as you can. All right, she's got some right-sided weakness.
Not every medical emergency is as dramatic as cardiac arrest, but recognizing the signs of a stroke quickly can be just as critical. During training, EMTs learn how to identify stroke symptoms using simple neurological assessments.
Right after the stroke screen that I gave earlier, I call ALS, upgrade it, give them a stroke alert. She's showing right-sided weakness.
Changes in facial movement, weakness in an arm, difficulty speaking. These signs can indicate a stroke in progress, and the faster patients reach specialized care, the better their chances of recovery.
She's at 3 and 5. Can you swallow? Are you able to swallow? Yeah, looks like she can swallow. Okay.
Every day across the region, firefighters, EMTs, and paramedics respond to medical emergencies that change lives in an instant. The skills practiced here are the foundation of that response. Behind every successful outcome is a team that has trained for the moment when seconds matter most.